versus, because they're always blue, versus a really dark blue dot, it doesn't tell us a lot about how many worms there are. It just tells us there's a lot of protein present that's produced by the worms, but that doesn't necessarily correlate to the number of worms. And keep in mind, part of that is because we only are able to test for the female, so it's a protein produced by the female heartworm. He also talked a lot about preventatives. And in veterinary medicine, we are taught if they are heartworm positive, you have to be really careful when you give them preventatives, because heartworms make babies called microfilaria, which are these microscopic little worms, basically, that float around the bloodstream. And we were always taught if you give them preventative while they have microfilaria, the preventative will, bam, immediately kill all the microfilaria, and they can have this like crazy anaphylactic type reaction. And what he was saying was the preventatives don't actually kill the microfilaria. It just allows the immune system to do its job better. So the anaphylactic reaction that we worry about, it can happen anytime, which is frightening but also interesting. So we used to say, all right, like the first time you get your preventative after you start on the doxycycline, then we need to keep you in the office for 8 hours and keep you calm to make sure you don't have an anaphylactic reaction. Technically, you could have that reaction at any point. So keeping them calm is very important, but they don't necessarily have to be observed because in theory they could have an anaphylactic type response at any point. And the other question that somebody asked that I thought was really interesting was, does giving preventative to heartworm positive dogs contribute to resistance? Because we are unfortunately starting to see a little bit of resistance to heartworm prevention, which is why we recommend annual testing. It's not just to be sticklers and to get a little extra money. It's because there can actually be drug failure, either due to the drug, so due to resistance, or due to human error. So maybe we left the box of heartworm prevention out in the garage and it went to -20 and then it went to 105. So those temperature fluctuations can inactivate the ingredients. Maybe we forgot for a month. Maybe that month was actually 3 months and we didn't realize it. So the concern becomes, if you have a heartworm positive dog and you're giving him prevention, is that going to contribute to resistance? And the answer is, if they're on doxycycline, that actually, so that antibiotic we give to kill the Wolbachia, the little bacteria that live on the heartworms, that actually can prevent the microfilaria from leaving the mosquito. So if a dog that has heartworm disease is on preventative and is bit by a mosquito, and let's say they have microfilaria circulating, that mosquito sucks it up, but then when they go to take a next blood meal, the microfilaria can't leave and infect another animal, which I thought was very interesting. So now we're going to hear from the presenter himself on what he thought was the most important lesson from his lecture.
I'm Brian Heron. I'm a veterinary parasitologist at Kansas State University. And when we're talking about heartworm, what we want to let our owners and veterinarians know is that when a dog's infected, the disease develops very quickly. And so if it tests positive, there's significant disease. Additionally, the longer the worms are there, the worse the dog is going to be. And the disease is progressive, and some of those changes we cannot take back. And so really, the best option is to have all of our pets, cats and dogs, on a preventive year-round to prevent having to deal with heartworm-positive animals.
So the next lecture I went to was about Lyme disease. And the presenter had actually contributed to the American College of Veterinary Internal Medicine, or ACVIM, consensus statement. And he pointed out, which is neat because they don't always talk about stuff like this, they pointed out that really everyone that worked on that consensus statement works at a tertiary clinic, meaning your general practice is considered your primary clinic, a referral clinic would be your secondary, so a regular specialist, and then the vet school is the tertiary, right? So the creme de la creme. And they tend to see stuff that's like a little more severe, and so they do have inherent bias. It's just interesting to hear them talk about it. So the first thing he said was a Lyme test tells you, a positive Lyme test, okay? So Lyme disease is a bacterial infection spread by Borrelia burgdorferi, and it is spread by the deer tick, or Ixodes scapularis. And if they are positive, that is an antibody test. So unlike heartworm, where it's an antigen test, so heartworm tells you there's an active infection. A Lyme test tells you that there has been exposure. It doesn't necessarily mean that there is currently an active infection. But he said that the way you should think about it is if they have a positive Lyme test, then their tick prevention has failed. So whether or not they've been using tick prevention or not, we know that that animal has been bitten by a tick. And there's unfortunately other common tick-borne diseases we don't routinely test for. So when we do a heartworm test at my clinic, we do what's called a 40X. So it's an in-house snap test that looks at heartworm disease, Lyme, Ehrlichia, and Anaplasma. So those are 3 of the most common tick-borne diseases. So the first thing you should think about is that prevention or lack thereof failed, and we need to really focus on helping prevent further infections of ticks, of tick-borne disease in our pets. The second thing he talked about was the Ixodes eggs are not actually infected, even if the adult is. So I always thought that there was complete vertical transmission, meaning that, it was nymph, larvae, egg, larvae, nymph, adult, egg. But actually, when the adults make the eggs, they are not infectious. And it's a 3-host life cycle over a 2-year period. And the nymphs can become infected, but they have to feed on a white-footed mouse that's usually chronically infected. So that's how the nymph becomes infected, and then they overwinter. And then when they go to take their next blood meal, so every life stage is basically separated by a blood meal, then they are considered infectious. And ticks, the way they feed, they do this thing called questing. So I don't know why, but when I was little, my dad always told me that ticks fall from trees, which is part of why we wore hats when we went walking in the woods. But they don't. They actually are mostly on the ground. I mean, they're almost always on the ground. And they quest, so they climb up to tall grasses or plants, and then they literally just stand at the top and wave. And of course, I'm sitting here waving, even though you guys have no idea what I'm doing. And I always wondered, do they just do that for hours and hope that something passes by? And so apparently they studied this. And what they're looking for, in part, is color. And they look for a white color against the blue sky. And if you think about it, it makes sense because the underbelly of most wild animals are white. They're also sensitive to carbon dioxide, which is what a mammal exhales. And they become the most active at 40 degrees Fahrenheit. So the adage of wear white when you hike because you will more easily see ticks is true because the ticks are literally going to be attracted to the white coloring of your clothing. And then I thought I was smart because I have a light colored, a tan dog, right? But I mean, that's just prime tick food because he's when he walks and he's light colored. So they're explains why I'll periodically find ticks on him. So I thought that was really, really interesting. And the other things, these are things I found interesting. The whole lecture for really all 3 that I'm going to talk about was very interesting, but these are just little tidbits that I said, and I just wrote them down, so I'm sharing them with you. So Rocky Mountain spotted fever is another tick-borne disease, and it can actually cause facial nerve paralysis or Bell's palsy in dogs and in people, and it can cause horners, so one eye looks bigger than the other, and then you have a droopy eye. And so when we have weird aberrant neurologic findings, especially in Virginia, because there's tons of ticks, we should really keep tick-borne disease in the back of our mind. One of the things we really worry about in pets with Lyme disease is something called Lyme nephritis, which is basically a kidney infection secondary, or kidney inflammation secondary to the Lyme disease. And it's actually an aberrant immune response. And we think that there's some genetic predisposition, but we also think it's due to repeated exposure. And that's why it's so important, even if a pet tests positive for Lyme, that we ensure that we're doing daily tick checks, we ensure that we're on adequate flea and tick prevention, and then definitely think about the Lyme vaccine, because every time they can get reinfected because it's a bacteria, unlike viruses where the immune system usually fights it off if it's exposed to the same thing again. But every time they get reinfected, you just up the chances that they could get a potentially fatal kidney inflammation called Lyme nephritis. And Lyme nephritis is not caused by the vaccines. There used to be a subset of veterinarians who were really worried about that, and they've proven that it is not caused by vaccines. Something else that he mentioned that was really scary to me is that they did multiple studies. It was a retrospective analysis, so they looked at a bunch of previously done studies. And of 135 control dogs, okay, so these were dogs that were infected with Lyme disease, they weren't given preventative, and they weren't treated, 86% of them had joint lesions and osteoarthritis from the Lyme bacteria. So that's huge. I mean, we think about Lyme disease and we don't always necessarily treat it if they don't have an active infection, but we just need to keep in mind 86% of dogs that had Lyme, that were exposed to Lyme, that were not treated, had arthritis. And the way they figured this out is by doing biopsies of the joints. And these were fairly quickly after the infection. So you think, 5-10 years down the line, these dogs are at risk for some pretty significant arthritis, in part because of the previous exposure to the Lyme. And the other things he mentioned was that to monitor for Lyme nephritis, we need to check urine, which we usually recommend at my clinic. And we also want to make sure that we're running a urine protein test, regardless, which is a specific urine protein creatinine test, regardless of what the initial dipstick says. So when we do a urine dipstick, it's literally like a stick that we put pee on, and it has a color indicator to tell us if there's protein. And if there is, then we quantify it with a urine protein creatinine ratio, or a UPC. But we should be doing that anyway, regardless of what the initial dipstick says. And anything over 0.5, we really need to keep an eye on, because that's kind of the cutoff for dogs where we worry about Lyme nephritis. And now I'm going to let the lecturer tell you his most important takeaway from his own lecture.
Hi, this is Dr. George Moore from Purdue University, and I was speaking about Lyme disease in dogs. And one of our concerns is that Lyme disease in dogs occurs with variable frequency, both by the geography in the U.S. as well as within individual dogs. But it's very important to control for the tick vector, to use excellent tick protection, because the risk to the dog is not only from the agent for Lyme disease, but for other diseases too. So we need to protect our dogs against infections from ticks.
So the last pre-light show / keynote speaker lecture that I went to in the morning was about leptospirosis, which leptospirosis is a bacterial infection transmitted by possums, skunks, raccoon, mice, foxes, farm animals as well, and it's shed in the urine, and we can find it in both stagnant and running water. So again, a couple of the random tidbits, key points I thought were interesting and horrifying. This lecture was kind of scary. 100% of raccoons in Indiana tested PCR positive for leptospirosis in the kidneys. That's pretty gross. So I guess don't kiss or drink the urine of a raccoon in Indiana. All bodies of water can have leptospirosis, even whitewater rafting, so like even rapids. And 50% of human cases occur in Hawaii, which is really sad because I always think of Hawaii as like this mecca where nothing bad happens. But they do a lot of like mud runs, and you can get from a lot of the water activities in Hawaii, apparently you can get leptospirosis. And there can be multiple hosts, not just in the water. And it can survive for 16 days in moist soil and 28 days in spring water. But it's not hardy. So direct sunlight will kill it, and any disinfectant will kill it. So if we have lepto suspects at my hospital, we always walk them like really far away. But technically, if they pee anywhere and it's a super hot sunny day, as long as that soil's not moist, they're going to dry up and die within probably 48 hours. It is very difficult for dogs and people to transmit disease, i.e. leptospirosis, in their urine. Contact with wildlife, livestock, and water operations are how people and animals generally get infected. She also mentioned that she has not seen dogs vaccinated with the 4 serovar vaccine get infected, but she has seen unvaccinated dogs and dogs vaccinated with the 2 serovar vaccine get infected. So the concern I've always had with the leptospirosis vaccine is it has 4 serovars and there's approximately 12 infectious strains. And so my thought was, okay, great, that gives you like a false sense of security, and there's no truly proven cross-protectivity, right? So like one strain doesn't protect you against other strains that aren't in the vaccine. But they're saying that even though there's no quote-unquote protectivity, dogs that are vaccinated against the 4 most common really don't get leptospirosis, which makes me a little more satisfied with the idea of doing the vaccine because I feel like I am offering better protection. So this was one of those lectures where you're like, I might change my thought process on something. The duration of immunity for the vaccines is at least 12 months, but that's it. It's a bacterial vaccine. It doesn't last longer for that. And then she talked a lot about how we test, and really, honestly, the summary of the testing and the diagnosing is a lot of times when they come in presenting with clinical signs of leptospirosis, so frequently like vomiting, diarrhea, liver failure, kidney failure. They may not test